Hello, my name is Shirley Wood, and this is my community plan for Pinal County, Arizona. It focuses on the correctional environment, mental health, and substance abuse. Introduction. Working in a correctional facility, there are many people with mental health and substance abuse issues. This provides a unique opportunity to reach out and provide this vulnerable population with resources and support dealing with the mental health and substance abuse issues they face. As of 2017, drug-induced deaths within Pinal County was 29.7 per 100,000 residents. In 2020, about 55.3 of incarcerated individuals stated they currently abuse substances, and approximately 31.8% of individuals stated they have a mental health diagnosis. The actual number is higher, as these figures only represent those who admitted to mental health and substance abuse issues. A pamphlet was created listing all mental health and substance abuse treatment providers within Pinal County, Arizona. Definition of community. Pinal County, Arizona is a rural community located between the major metropolitan areas of Phoenix and Tucson. Approximately 450,000 residents reside within Pinal County's 5,373 square miles. Pinal County lies completely within the Sonoran Desert and boasts 5 state parks, 4 wilderness areas, 3 national monuments, 2 national forests, and a national scenic trail. The Sonoran Desert is the wettest desert in the world and boasts a diverse flora such as the saguaro cactus. Pinal County has a larger area that is more urbanized, mixed within the rural areas. Windshield survey. The majority of houses in Pinal County lie in subdivisions that were all built within the last 20 years. These houses consist mainly of single-family homes. There are many miles of sidewalks that are well maintained in the subdivisions. Overall, the community is clean without much litter. The schools appear in great condition, and it is important to note that many of the schools were built in the past 15 years. The air quality in Pinal County varies. During the summer months, the area is prone to dust storms and monsoons. The dust storms may or may not bring rain, and at those times, the air quality is poor. In the year 2000, Pinal County's population consisted of approximately 180,000 residents. A population boom that started in 2000 and is ongoing has increased the population to 150% of that. Community assessment data generation. As of 2017, drug-induced deaths within Pinal County was 29.7 per 100,000 residents. In 2020, about 55.3% of incarcerated individuals stated they currently abuse substances, and approximately 31.8% of individuals stated they had a mental health diagnosis. 81% of those surveyed in the Pinal County 2020 Community Health Needs Assessment stated that they knew someone that had a mental health condition. According to the Pinal County 2020 Community Health Needs Assessment, mental health issues and substance abuse issues were identified as the top 2 health issues affecting the county. The rise in fentanyl use in the past 18 months is sure to increase these numbers. Yesterday, I encountered a person in the Sally Port of the jail as I was conducting a COVID screening on them. They were talking to me initially and soon passed out. I ended up having to call EMS services and administer Narcan, and EMS also administered Narcan as well to bring this person around. We're finding more and more people within the community abusing, especially fentanyl, and the number of overdoses. It will be interesting to know the percentage of those. They will more than likely rise. Community partners and resources. Deputy Chief Matthew Hedrick oversees the Pinal County Adult Detention Center and reports to Sheriff Mark Lamb. Chief Hedrick is very enthusiastic for this project, as it is his passion to return people back to the community in a better state than when they arrived. Amy Galpin is the Health Services Administrator for Wexford Health Sources. She has 14 years of experience at the Pinal County Adult Detention Center, and she has been the HSA for the past 4 years. Sydney Cooper and Melissa Candelaria are advocates at Community Health Associates, and they assist people with getting them onto the state Medicaid, which is called the Arizona Health Care Cost Containment System, or ACCESS for short. Michelle Plouffe Metcalf is the Community Impact Manager for Community Medical Services. What they do is a MAT treatment, a medication-assisted treatment facility that helps people with opiate addictions. Community health diagnosis. My nursing diagnosis is risk of ineffective health maintenance among incarcerated individuals being released from the Pinal County Adult Detention Center related to deficient knowledge of substance abuse and mental health treatment facilities and options within Pinal County, Arizona, and ineffective community coping among incarcerated individuals being released from the Pinal County Adult Detention Center related to inadequate social support system in Pinal County, Arizona. My goals and objectives for my nursing diagnosis are: upon release from the Pinal County Adult Detention Center, individuals will receive information on substance abuse and mental health treatment and counseling centers available in the community of Pinal County, Arizona. Within 1 week of release, individuals will contact facilities to seek continued treatment and/or counseling for substance abuse and mental health concerns. Within 1 month of release, individuals will have engaged in community treatment facilities. Within 1 month of release, individuals will demonstrate effective health maintenance. Community health plan and interventions. With the permission of Chief Matthew Hedrick, a pamphlet was created listing all mental health and substance abuse treatment providers within Pinal County, Arizona. This pamphlet will be distributed to all incarcerated people upon release. Due to the relatively short incarceration period of less than 30 days per the jail population analysis, the pamphlet has the potential to be distributed to hundreds of people each month. The pamphlet provides community resources to those released in order to promote effective community coping and health maintenance. Amy Galpin gave permission to research the data contained within Core EMR to research how many people entering the facility have identified substance abuse disorders and/or mental health issues. Core EMR stands for Correctional Electronic Medical Record. A survey of those currently incarcerated within the Pinal County Adult Detention Center was also conducted. Overwhelming feedback of 88% of those surveyed stated that the mental health and substance abuse provider information would be beneficial to them. Evaluation methods. To monitor the benefits of this pamphlet upon this population, a Likert survey was created that will rely upon user participation. On the back of the pamphlet is a web address for the survey. A weekly audit of the survey data will be conducted. As part of the survey, there are questions and comment section on how to improve the pamphlet. Summary. This project addresses primarily those who are being released from the Pinal County Adult Detention Center. Due to the high prevalence of mental health and substance abuse disorders within the community, a need to consolidate resources was determined. With the permission of Deputy Chief Matthew Hedrick of the Pinal County Adult Detention Center and assistance from Amy Galpin, RN, Health Services Administrator, the production of a pamphlet containing mental health and substance abuse treatment providers was created to distribute to those being released from the facility. To monitor the benefits of the pamphlet upon this population, a Likert survey was created that will rely upon user participation. Below in the next two slides is a copy of that pamphlet.